I think there's lots of data for transplant patients, and really patients who are much in better functional state going into transplant do much better afterwards, and they recover much faster. And usually stem cell transplants in early lines of therapy. For CAR T right now, we're in very relapsed refractory patients, and again, in the real world, performance status is not great. And so we have a program at some centers, multiple centers have individual programs, where we will do something called prehab. And so here, patients, once they're identified as CAR T patients, they'll go in and see, if they're older, geriatricians. Pharmacy will actually go through all their medications to make sure we're optimizing. Fluid-wise, do they need less fluids, et cetera? So if they have, renal issues or cardiac issues, we actually get cardiologists and nephrologists involved as well, and physical therapy and occupational therapy, and nutrition. So they actually get this, plan to follow for mostly physical therapy and occupational therapy, what exercises they need to do to stay strong, and what they need to do after they get the CAR T. And then everyone follows up post-CAR T as well, even 30 days later if they need it, in efforts to improve outcomes. And we have shown data with mostly lymphoma patients where this has helped patients actually improve in terms of their physical status. And our next goal is to do something prospectively where we can actually look at biomarkers and then see if there's changes we can do, let's say, in that nutrition plan or in that physical therapy plan that can actually help improve outcomes with those biomarkers.